Welcome to another episode of the Dr. Truth Show with your host, Dr. Michael Hall. It is May 27th, and it is Thursday afternoon. Let me just clear the air. There we go. A little levity to bring about good energy. And today's topic will be a mixed topic, and we will try to focus on more positive elements of health rather than dwell on COVID and all the negativity around that. There is some breaking news with COVID, which I think is very positive. Dr. Fauci was called out by Dr. Rand Paul, who is a senator from Kentucky in the U.S. Senate. And he did last week specifically call out Dr. Fauci for his involvement in funding via the NIH gain of function research that occurred at the Wuhan Virology Lab. And that research has been apparently ongoing and was moved from North Carolina, Fort Detrick, to Wuhan after about a 2014-2015 governmental ruling prohibiting gain-of-function study on U.S. soil. So that biological warfare device, which I believe it is, was moved to China to be done in a surreptitious manner to avoid laws and regulations that were enacted in the United States to prevent exactly that sort of research. That's rather good because we are calling Dr. Fauci out, and Dr. Fauci was involved with a lawsuit in 2016, 2017 in Miami. It was very, very profound because at that time we were being sprayed with an organophosphate neurotoxin called NALED, and that was being used to prevent Zika, the Zika epidemic. Actually, it was trying to attempt to force upon the population of Miami and Miami Beach an unproven treatment for Zika, which is a virus, and it was being carried by the Egypti mosquito. And a group of people in the United States obviously were being affected by this particular disease, although it never actually appeared in the United States. It was happening outside the United States, but we were being told it was happening here. So that's a separate discussion. It deserves its own podcast, its own discussion, completely separate from what we're talking about today, but I'm just bringing up the good news about where the direction of the COVID nightmare is headed, and hopefully we find exposure of some sunlight on where these folks started this and came from and how we're going to address it going forward. So what I want to discuss now is I had recent stem cell therapy on my left hip because of treatment that I had used during my COVID episode. And unfortunately, I developed a syndrome called AVN, avascular necrosis. I won't really go into that, but it's basically the impairment of blood flow into the femur head, which is part of the long bone of the leg. That impairment of blood flow prevents bone formation being properly made or laid down by the osteoblasts, which build bone, and osteoclasts, which then destroy bone. So those two cells work hand in hand to remake bone and remodel tissue in the bone. And anyway, that went awry in my situation. So I had a therapy that is not necessarily really that avant-garde, but they took bone marrow extract from my hip, they took fat from my buttocks, and they took platelets from my vein for my circulation, and basically took them out, mixed them together, and re-injected that mixture into my left hip. And that is to help heal and repair some of that bone damage caused by the avascular necrosis event. So while I was at the doctor's office, I learned some new things regarding what can be done potentially for joints and bones in particular that have developed wear and tear, osteoporotic changes or loss of bone density, to osteoarthritic changes, which is compromised bone articulation because of changes in wear and tear on the bone surface. So you have bone density issues, you have articulation issues, and all of these things are very difficult to repair once the damage has occurred. So part of this therapy involves using your own body's stem cells to actually reformat the damage and actually repair it. So we use PRP quite a lot in our office, which is a procedure that was actually developed in Germany many, many years ago. It's probably about a 50-year-old procedure. It's been perfected over the last 25 years. It's been used in equestrian environments with thoroughbred horses to injections of little old ladies' knees. And that all is pretty impressive considering the fact that they're taking cellular products from your bloodstream and centrifuging those into a small micro amount. So typically in our office, we take either 60 or 30 milliliters of blood and put it into a cassette and put that into a centrifuge. And that centrifuge then is turned on for about 15 minutes and it strains out the products we don't want from the products we do want. And then we withdraw the products we do want from that little cassette and put that into a syringe and actually use a small needle. Usually it's a spinal needle, which is about a 27 gauge long needle. And we can inject that almost to any joint or muscle tendon on the body and get repair. I think most people have heard of it by now. They've heard about the vampire facial, which is a PRP procedure they can use topically on the face, to these other PRP procedures they may have read about by sports figures and in the lay press. But regardless, it's a procedure that does work, and it does have a very impressive track record. I would say about 80% improvement into the joint that it's being injected to on average. In a muscle or a tendon that's been damaged, it can be even higher in the sense of improvement, maybe even up to 90% improvement. And we're talking about demonstrable change on an MRI or ultrasound, seeing new tissue, less scar tissue, less fibrotic tissue, more muscle or tendon that may have been damaged through a trauma or some sort of loss for a variety of different reasons. So that's something really important to understand. And I think as the technology becomes more and more understood by the general population, I think it's a first step option to improving a tired or worn out joint instead of having a major surgery. And that could be arthroscopic surgery. That could be a major replacement of that joint, being a knee or a hip. And also, I think there's a good amount of evidence that shows that just damaged tissue anywhere on a limb can be potentially improved. An elbow, a wrist, potentially even inside the ankle, where you have arthritis that may be very difficult to get to treat, but at the same time is causing huge impairment or immobility. And I think this is a tremendous asset. So, and the reason why I bring that up is because I think also with regard to COVID and what I experienced, the treatment that I used for treating my COVID involved a steroid, and that steroid created the problem for me, and that could happen to others. So I think that part of the discussion today is just understanding that there are treatments for musculoskeletal concerns that may be attributed to different reasons: trauma, medication, other issues could be birth defects, and all of these could potentially fall into an area where you could have a simple blood withdrawal and a PRP procedure and might have dramatic improvement. Something to look up and do more research on for yourself. One of the things that did come out of my discussion with the doctor that treated me is he came across a couple of new products that he's been active in promoting, and one of them is an FDA topical approved product that comes from a company called Contrad. It's a Swiss company that actually makes this product, and it's imported into the United States legally. And there are products that are called Simolex, Sigmolecs. So this technology uses pretty advanced, we'd call them cell regulators. They're tissue activating substances that can be applied topically to tissue that's been damaged, a joint, tendon, something, as far as even perhaps, as an injury that could be chronic or acute in nature, and have that delivery system brought into the tissue through the gel, which uses an occlusive film dressing called a tegaderm dressing. So the material is applied inside the tegaderm dressing, which is almost like a little thin sheet of saran wrap with a sticky side to it. And that particular dressing, it's a medical dressing. You can apply it to any part of the body. The material is applied inside that dressing and it's put onto the body's surface, the skin, directly. And that material is liberated through these very small nanoparticles into the tissue and actually can be absorbed into the joint or tendon or muscle or whatever's area of treatment. And there are several types of this product that can be used, some for inflammation, some for regeneration, some for pain relief. So this is something fairly new. It's very safe, and the product seems to be effective. So this comes from a Swiss factory that's shipped to the United States and is FDA approved for topical use. So just something more to learn about and understand that this could improve the elasticity and mobility of tissue. And there's apparently good evidence and scientific study behind this. And there's also a product that can be used directly on the skin. And this could help the texture of the skin. It could actually help with sun damage and also help reduce dark spots. So these are unique nanoparticles that help tell the cells what to do, help regulate the cell's activity, and encourage healing. So I like that. Anything that is natural, healthy, and safe, that's non-dependent and less pharmacologic and more natural, holistic in nature is always a plus when it comes to dealing with the human body. In our office, we are driven toward trying to research and discover these newer products that potentially would have a benefit without having to spend time in an operating room or being on expensive medication, having prescriptions and things like that. We like to fix things and just let the body naturally heal. So, but that'll give you some new ideas, and hopefully our next podcast we can talk about some other newer things that we're doing. And in fact, there are some exciting things in the anti-aging world that are starting to come around. And I think because of the emphasis that's been placed on COVID and the pandemic, people are really looking for ways to stay healthy. So that's great. And we want to encourage that. We want to promote that. So part of the process now will be to encourage people, our listeners, to have questions, and maybe they can bring up certain concerns that they may have regarding health and wellness, and we can answer those. So think about that. But Appreciate your time. And if you want to reach out, 305-672-4733 or our email address, clinic@halllongevity.com with 2 L's. God bless and have a great week.